Have you ever seen a child that is born with some swelling at their back, what's called neural tube defect, or cleft lips, or children who are born with what we call imperforate anus? There's no opening in their anus for them to poo. There are many more deformities that a child can be born with. Now the question is, what is the commonest cause of some of these neural tube defects and these defects in children? It's something we call the deficiency of folate, which brings us to today's topic, the importance of folic acid. Hello everyone, I'm Dr. Chukwemeka, Dr. Chuks. So today I'll be talking about folic acid like I promised in the last video. It is one of the most accessible, it is one of the cheapest, and is one of the most available medication I have seen in my entire practice as a doctor. Folic acid is very accessible. So now, all a pregnant woman needs is just 1 tablet a day, which usually comes as 5 milligrams. Now, even those who are planning to get pregnant, they can still take folic acid. Yes. So preconception, before pregnancy, first trimester, second trimester, third trimester of pregnancy, even during preperiod, that's the first 6 weeks of delivery, you have to be on folic acid. Now let's talk about the importance in the first trimester of pregnancy. It helps in the development of the child in all the formations, because that first trimester is when all the organs and tissues, organs and systems of the baby are being formed. So those children who are born with those swellings in their back, which is called neural tube defect, different types, either spina bifida, occulta, or those who are born with cleft lips, those who are born with anus that is not open, they can't poo. Most of these things, the commonest causes are deficiency in folic acid. So every pregnant woman, please, if you have not been taking folic acid, start taking. If you have been playing with it, because most people play with it in first trimester, and the reason being that first trimester is the most challenging part of pregnancy. What do I mean by that? It is a time when the woman has a lot of symptoms, but I'm going to talk about that in details in other videos. So she doesn't want to take any medication. She doesn't want to eat much then. But what do? You need that folic acid. So force yourself to take folic acid your first trimester. Force yourself, force your sister, force your aunties, everyone you know that is pregnant. Encourage them. Don't just force them. Encourage them to take folic acid. And you'll be glad you did. It will help to avoid all these neural tube defect, all these congenital malformations in the child. And there are categories of women who should not even joke with it. I'll talk about that in the next video. There are categories of women who should not even take folic acid at all. I'll talk about that too in the next video. But for now, these categories, they are very few. They are very minute. All you need to know is, as a pregnant woman or a woman who is planning to get pregnant, or a young woman within reproductive age, folic acid is very good for you. Very important. In the pathway that converts, where the enzyme methylionate tetrahydrofolate reductase converts this folic acid to folate. Although there are some studies that show that some people are even deficient in those genes, MTHR genes. But don't worry, it's big English, but we don't need those information. All you need to know is that just keep taking folic acid if you're pregnant or you're planning to get pregnant or you just delivered. And I'll talk more next time on the other categories. See you. Bye.